diets that are high in refined sugars, diets that are high in white food, white breads and things of that nature, sodas and things like that. All of those things create an acid attack on your teeth every time you have a meal, okay? And bacteria that we all have in our mouth, not just me, not just you, nothing separates us, we're all together. That bacteria is going to take those sugars and things, they're going to metabolize more in a layman's term, break it down and use it as a food source, and as a result it produces acid.
So that means kids can't eat? Like people shouldn't be eating
no.
There's a amount you're supposed to follow, I'm assuming, of each of those foods or sodas.
Right. We should be following the dietary pyramid they used to talk about back in like elementary school.
I see that since third grade.
That's not really the something.
Yeah. So like vegetables, then breads, then vegetables, fruits,
the pastas and the dairy.
Yeah, the dairy's at the top. Yeah, sugar's at the top. Sweets and things like that, high fats and things at the top, because they should be in the smallest amount that's consumed. Absolutely.
So the second part of my question, again, going back to the things that I saw in the classroom, and even talking to parents, right? And I know there's a lot of conversations about health insurance and dental insurance. And so I wanted to ask for, if I'm a parent, I'm working, I love my kids,
Absolutely.
I can't afford to take my kid to I don't have the right insurance to take my child to see the dentist. Are there any ways, is there something that's available to where I can get some assistance or something? Are there other programs out there that could help me?
Absolutely. I'm glad you brought that up, because depending on the income level that you're at, the state of Georgia has a program that's called Georgia Health Providers, which is Medicaid. And what that does...
Georgia Health Providers?
GHP, exactly. Okay. Yes, sir. And what happens with them is that organization provides insurance to minors, people that are 20 years of age and younger.
Okay.
Specifically, for basic dental procedures, routine or restorative procedures, routine cleaning procedures and things of that nature, routine radiographs and routine examinations. And pretty much for young people, they really are not going to have a lot going on other than having a few cavities and things like that. Or if they're not flossing as they ought to, they'll start to develop maybe like gingivitis. But with parents taking advantage of that program, those that qualify for it, you can pretty much eradicate those issues in your child, and at the same time it'll couple that child with a dentist or a dental office that will be able to help to reinforce healthy hygiene habits. You know what I'm saying? So that those children and adults will be able to learn how to take care of themselves at home, because you got to realize most people only come to the dentist twice a year if they come for cleanings. There's going to be 363 other days that's going to roll by. It's really important to educate those people and to make sure that they know how to take care of themselves at home, so that when they come back, the areas that they weren't able to clean as well, and we know they're going to be there, but with those areas, it won't be so profound. Yes, absolutely.
So, kind of like you mentioned earlier, you said as a younger individual, you weren't really confident in your smile.
Absolutely.
I have the same problem.
Okay.
But I blame my parents.
Absolutely.
I think this gap that I got in my teeth was from my mom's side. But personally, I've always wanted braces, but I didn't want the metal in my mouth.
Right.
At a younger age, and then when I grew up, I found a whole bunch of substitutes and other ways you can go around it.
Absolutely.
So I had a two-part question as well.
Sure.
First being, what's the best substitute beside metal braces that you would recommend? Not just for me, but for others. Okay, so
they have several systems that you can use in order to align the teeth. Invisalign is a very popular system that's used. There's a second one that's a competitive Invisalign, which is known as ClearCorrect. The only drawback that I have for those retainers that are used to align the teeth versus just your straight wide orthodontics, which is your braces, the only issue that I have is patient compliance. With those retainers, patients have to be aware and they have to be responsible enough to comply and wear those devices and appliances on a regular basis as they ought to, without being told. They have to be internally motivated. Otherwise, patients will spend that money, they won't wear the retainers as they ought to, they won't see their teeth move, and then they will be upset and say, this doesn't work, this is a fake, for lack of a better term. So that's why I recommend the straight wall orthodontics for patients who say they realize that I got a busy schedule, or I'm not going to follow the instructions. Otherwise, those other two options that I gave work very well. And the technology that is with those has allowed those two types of aligner systems to be able to correct more advanced cases, meaning more complicated cases, cross bites and things like
Yeah,
that. You
I
can
heard
do,
that.
yeah. So those are things that we're looking at.
Got you. Last, I was just gonna ask, what's the worst thing you've seen since you've been a dentist?
Worst thing I've seen since I've been a dentist, I met this guy. He was in a like a halfway house program, and I think he'd been homeless for a long time. And he came in, and he pretty much had, out of the 32 teeth, he probably had about 26, 27 of them left, which is a lot. But they were all broken down at the gum line all the way around.
Oh, wow.
We had to remove all of that,
Oh,
perform
wow.
pre-prosthetic surgeries to smooth the tissues and things, or smooth the hard tissues down. And then after we did that, at that point we sewed everything back up. Patient came back, we made a nice denture for him.
So you gave him a new mouth.
Yeah. But that's not the goal. It looks good start to finish transition, because we always like to see a dramatic start, dramatic finish. But honestly,
Health-wise.
health-wise, I mean, once it's done, it is what it is. And I mean, we can also place implants and things of that nature to help to retain like the bone that's underneath the gums, which we need because that's our foundation. However, I would much rather just see a boring patient come in who they floss, brush like they ought to, because they're healthy, you know, and they're going to have their teeth, they're going to be able to enjoy their food, they're going to have a much higher quality of life, and as a result of that, because they don't have a lot of dental issues, they're not going to view dentistry as a butcher shop.
like me. So real quick, I wanted to make sure that, for one, the amazing work that you do.
Thank you.
I have been coming to you for a few years now,
Thank you.
and
Thank you.
some of you may have seen me talk, or you've heard me speak about Dr. Marable and the great dentistry that he does. So I wanted to ask you, are there any warning signs that people can have or that they'll experience that lets them know? For example, because I know the last time I had like a small cavity, I had no idea. So
Right.
is there something that are the things that I should be checking for, regularly? And how often should I come to the dentist? Is it once a year?
Okay.
And brushing your teeth, or what did you tell me? 2
2
minutes
minutes,
and
yes.
things like that. See, I
Yes,
didn't know
sir.
any of that. So what are some of the warning signs that people may have, and,
Okay.
and how often should people come to the dentist?
Okay, well, I'm gonna answer that second question first. So, in a situation where the patient has pretty much a healthy mouth, we want to see those patients every 6 months. Okay, and for all patients, pretty much the baseline should be every 6 months. Depending on their oral health conditions, once they come to the office, if they need more extensive hygiene procedures, at that point they may need to come on an every 3-month basis or an every 4-month basis. But going back to the original question, every 6 months is a standard baseline to go by. As far as young children go, when it comes to seeing a pediatric dentist, a pedodontist, recommendations are when the first tooth comes into the mouth. You know,
Oh, wow.
For general dentists, a lot of times our rule of thumb is at age 3.
Okay.
You know, we want children to come in. But as far as warning signs, patients who have sensitive teeth when they drink or eat, normally your teeth are not supposed to be sensitive. That could be a sign of decay going on in the mouth. If a patient has a chronic malodor coming from their mouth, or if a patient, they notice that their gums bleed when they brush, healthy gums never bleed.
Wow.
Never. That bleeding is caused by an inflammatory process.
Okay.
So, and if you have an inflammatory process going on in the body, that means there's something going on that's irritating something, which results in inflammation.
Right.
So,
And brush your teeth for
2 minutes.
2 minutes a day, and the most important thing, or one of the, I guess the
Flossing.
equivalent is flossing, right? You always make your floss.
Right, and I'll say this, and I probably shouldn't say this on camera, but I'll say it anyway. Don't worry about it. If I had to take the two processes of cleaning the teeth, brushing and flossing, and I was stuck on the aisle and I could only have one and had to let the other go, I would choose flossing over brushing.
Really?
Focus on the dentist.
Flossing, what, at night or morning, does it matter?
Anytime.
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 And brush your teeth, what, twice a day? Or?
Twice a day. And so I say this. An old guy told me a long time ago, told me 2 things. He said, you don't have to brush all your teeth, just brush all the teeth you want to keep.
Thank you so much, Dr. Marable. Okay.
You know, and he also told me in regards to brushing your teeth. You brush your teeth in the daytime to keep your friends, but you brush your teeth at night to keep your teeth.
Oh, wow.
You heard that too?
Wow.
I see.
My dog, yeah.
Thank you so much, Dr. Marable, for all the information that you provided. Remember, audience, that Make sure you're brushing your teeth and that you're always flossing. If you ever have any questions, you know, Dr. Marable can be found where? Where are you now?
Downtown Dental Center, 75 Marietta Street. If you needed the numbers, area code 404-577-0868. Just call and ask for an appointment with Dr. Marable.
And he has my highest recommendation, all right?
He's about to have mine.
So now we're at the point of the show where Kola told us going to.
What we normally do is we like to close out by asking our guest a book of the week. We do a book of the week, anything he may recommend, anything that's a great read, that feel like has great value in the book. So, do you have a book of the week?
Yes, I recommend, this is a throwback book from elementary school, but it's good stuff, okay? Roll of Thunder, Hear My Cry by Mildred D. Taylor, okay? Very good book about, and the book is a story about a Mississippi family living in the 1930s in segregated South Mississippi. The family's a landowning family, which is distinguished because of the fact that it's an African American family and they own their own property, so they work for themselves, you know, in the midst of time where you had Jim Crow, which was very prevalent, you know what I'm saying, and things of that nature. And that resonated with me just because of the fact that I grew up on a farm, you know what I'm saying. So that I kind of saw myself in that growing up, and I even read it to this day. But excellent book, man, excellent book. And it's actually in a series of Roll of Thunder, Hear My Cry, Let the Circle Be Unbroken, and Road to Memphis. All three of those books are boom, 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 boom. They're all by Mildred D. Taylor, though.
Thank you so much. All right, so make sure you check that book out. And again, we would like to say thank you so much, Dr. Marable.
My dog.
All right.
Appreciate you, homie.
I love
All
that.
right.
Nice to meet you, brother.
Thank you again for tuning in
Get it right.
to the Brown Paperbag Series. We'll catch you next week.
All right.
Take care.